Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's session is part of our Paving the Path to Wellness series, a special collaboration between the Blum Center and the Paving the Path to Wellness program within the Lifestyle Medicine at Mass General Cancer Center. Before we get started, I just want to get a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has music here, our guest speakers today. If you have any questions or comments you'd like to share, you can use the chat feature, which is located at the bottom of your screen. Only Blum Center staff and our guest speakers will see your questions and comments. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so joining us today, we have Dr. Amy Commander. She is the Medical Director of Mass General Cancer Center in Waltham and Director of Lifestyle Medicine at Mass General Cancer Center. Joining us, we also have Elizabeth Abraham. Elizabeth is a Senior Clinical Research Nurse with the Paving the Path to Wellness program at Mass General Cancer Center. And then we also have our special guests, Lizzie and Judy, who are Paving graduates and breast cancer survivors. They are here today to lead our session on Thrive with Intention, how the Paving the Path to Wellness program helps you optimize health and well-being after cancer. So next, I'm going to turn it over to Dr. Commander, who will get us started.
Thank you so much, Amy, for that kind introduction, and thank you for helping us organize this series. We're so excited to kick off this series and provide education about the benefits of the Paving the Path to Wellness program, certainly for our individuals with breast cancer, but actually for all cancer patients and their caregivers and loved ones. So we're going to start with a few slides just to introduce the program, and then we're going to turn it into a discussion where you can really learn from Liz and Judy, because we know that it's so much more interesting to hear the patient perspective. So I'm just getting my slides up, so thank you for bearing with me for a second here. So today we're going to talk about the Paving the Path to Wellness program, which is a program I was so excited to launch in collaboration with my colleague, Dr. Beth Frates, back in the fall of 2019. So we're over 5 years old, and it's been such an exciting initiative. And now, as you will see in this presentation, we have an incredible team working in this area to bring the lessons of this program to patients at the Mass General Cancer Center and now beyond. And so the title of our presentation today is Thrive with Intention, how the Paving the Path to Wellness program helps you optimize health and well-being after cancer. Our objectives are outlined here. First, we're going to discuss the importance of health promotion as a key component for cancer survivorship. We'll introduce the concept of lifestyle medicine and describe the 6 pillars of lifestyle medicine and why they're important for cancer survivorship. And then finally, we will explore how the Paving the Path to Wellness program provides evidence-based education about the role of lifestyle medicine in cancer survivorship and how this program empowers cancer survivors to adopt healthy behaviors. So I thought it was important to start with this slide, which really highlights, this is good news, the growing number of cancer survivors living in the United States. So as you can see on this slide, which shares data from the American Cancer Society, by 2030, it is expected that there'll be 22 million individuals with a history of cancer living in this country. And that's really due to advances in treatment. Thankfully, our patients are getting cured, they're living longer, they're thriving, and this is really important and wonderful information to share. So if you look at who is living with breast cancer or other cancers, you can see, breast cancer, there's close to 5 million breast cancer survivors by 2030. And then in addition, uterine cancer and thyroid cancer survivors are quite prevalent among women. And then if you look at the other panel looking at male cancer survivors, we see 5 million prostate cancer survivors living in the United States, followed by colorectal cancer and individuals with a history of melanoma. And of course, there are so many other diagnoses that we see. And so it's really important to highlight this as we think about how we can optimize survivorship care for all of these individuals. So some may question, what does it mean to be a cancer survivor? Even in my own breast oncology clinic, sometimes my patients ask me, am I a cancer survivor? How do you actually define that? So because we're talking about survivorship, I thought it was helpful to share this definition from the National Cancer Institute. And I actually really like this definition because it's very broad and all-encompassing. And as you will see, survivorship focuses on the health and well-being of a person with cancer from the time of diagnosis until the end of life. And this does include physical, mental, emotional, social, and financial effects of cancer treatment that begin at diagnosis and continue through treatment and beyond. And I think it's also really important to emphasize that when we think about cancer survivorship, we're also thinking about family members, friends, caregivers, and loved ones who are part of the survivorship experience. So I love this definition. And I think over the course of our discussion today, you'll see how programs like PAVING help optimize health and well-being and quality of life for individuals with cancer. And so thinking about cancer treatment in 2025, wow, I mean, we've had so many advances. There are so many changes, even in the time I've been at MGH in terms of how we treat breast cancer and all types of cancer due to advances, for example, in immunotherapy and changes in how we administer radiation, updates in surgery, targeted therapies, hormonal therapies, you name it. So this is just an example of a patient, and we can imagine some of our patients do actually receive all of the treatments listed on this slide. For example, a patient with breast cancer, she may get chemotherapy and immunotherapy, followed by surgery, then radiation therapy, hormonal therapy, targeted therapy. And this is true for all types of cancer. So I think it's really important as we think about cancer survivorship. Certainly, we want to address side effects and toxicities from all these treatments and help our patients recover from that, move on, and truly thrive after they've undergone their cancer treatment. And this slide really highlights the key components of survivorship care. And if you're a cancer survivor and looking at this slide, it probably resonates with you. These are a lot of the things that probably come up in your follow-up appointments with your doctor or nurse practitioner. For example, monitoring for any signs of cancer recurrence. Are you up to date with screening for other types of cancer? So important. Thinking about genetic testing. And of course, as I mentioned on the previous slide, thinking about managing those physical, long-term, and late side effects from all the different types of treatment that are administered. Attention to psychosocial issues, so important. And then finally, what we'll really focus on today is how do we promote healthy behaviors? And again, sometimes in a routine oncology visit, there's really not enough time to really address all of these in great detail. And that's why programs such as PAVING are so important. Okay, you might be saying, well, what is this lifestyle medicine thing? I've never even heard of this. And I will be honest, I hadn't heard of it either until about, when I first started at MGH back in 2012, I remember seeing a flyer for a conference being sponsored by the Institute of Lifestyle Medicine and Harvard Medical School. And it was focused on lifestyle medicine. And I'm a runner and I'm like really into obviously being healthy as a doctor, but I was like, gee, this looks like a really interesting conference. So I went and I attended and I learned so much. And I realized why these tools are so important, of course, for cancer survivorship. So this slide shares the definition of lifestyle medicine, which involves the therapeutic use of evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. In addition, use of lifestyle medicine empowers the individual with knowledge and life skills to make effective behavior changes that can help address the underlying causes of disease or, again, reduce the risk of other health problems. And we think about the 6 pillars of lifestyle medicine, which are outlined here. And you'll see in the course of the PAVING program, which we're giving an overview of today, we touch on all of these topics. And in this lecture series, which, by the way, will be offered over the course of this year, we're going to go into each of these topics in depth, but we will focus on the importance of nutrition. We're going to talk about why sleep is important, exercise, the importance of avoiding risky substances, the importance of stress management, and the importance of prioritizing healthy relationships. So now I'm going to introduce the PAVING program. So where does this come in? So I mentioned that conference I attended a number of years ago. There, I was fortunate to meet Dr. Beth Frades, who's a leader in the field of lifestyle medicine. And I met with her and I wanted to start some kind of program for my breast cancer patients. And at that time, she had just launched this program called PAVING for stroke survivors. So we began a collaboration and I wanted to adapt this program for breast cancer survivors. And this is an overview of the program, which, as you will see, is relevant to individuals with all types of cancer of all stages. And the mission of the program is to provide education about evidence-based lifestyle interventions with the goal to promote health, well-being, and improve outcome for individuals with a history of cancer. In addition, we want to help empower individuals with these tools so they can optimize their health. And we're going to learn from Liz and Judy later in this presentation about whether they think the program worked to help them with that goal. And you can see that there's 12 steps for the PAVING program, and we're going to go over these briefly today. But again, over the course of this series, we'll take a deep dive into each topic. As Dr. Frades would say when she developed this program, the goal was to help individuals achieve a healthy body, peaceful mind, and joyful heart. And so each of the steps is related to those particular pillars. In addition, we learn about action steps. How can we actually achieve those goals? So the program encompasses all of these topics. So Liz and I are going to go through these briefly, and then we will leave some time for discussion. So, PAVING is a mnemonic. We love mnemonics. It helps us remember things. So P is for physical activity. So I just want to highlight the American Society of Clinical Oncology, which is our major oncology organization, actually states that exercise is a key component of oncology care. And you can read it here on this slide. We should be talking to our patients about the benefits of aerobic and resistance exercise during active treatment with curative intent and beyond. And so, there's so many benefits of physical activity, which, by the way, we are going to discuss in depth at our webinar in October. So they're outlined here on this slide, but I just want to plant the seeds that exercise is medicine. Moving on, the second important topic is attitude. And wow, this is a big topic in the concept of cancer survivorship. We know our patients are facing so many stressors, fear of recurrence, anxiety, scanxiety, you name it. We learn it all from our patients in the course of this program. So we discuss strategies for how to best manage these fears and anxiety and stressors that one faces during the course of cancer treatment. Now I'm going to turn it over to Elizabeth, who will review the other topics for PAVING.
Thank you so much, Dr. Commander. Hello, everybody. So V is for variety. As Dr. Commander said, our PAVING program mnemonic it's an acronym for all of the topics that we discuss. So variety might not be as commonly thought of or as, quote, popular of a topic as people might expect to learn about when attending a wellness course. But what we try to encourage and what we try to promote is variety in all of the topics. So this kind of quote here, variety is the spice of life that gives it all its flavor. We bring it back to the 1700s from William Cowper's poem, The Task. I just love this kind of visual image of the colorful spices on the screen because it reminds us that incorporating variety, not just in nutrition with spices and a variety of colorful food, but variety in everything we do is so important. Having a variety of physical activity, exercises, keeping a variety of social connections in your life is so powerful and can make such an impact on our wellness and our health. So this topic we dedicate an entire session to, which, by the way, we do meet weekly for 90 minutes each week. So each topic that we're highlighting briefly here with you today is talked about in great depth and discussed with the group. So I is for investigation, and this one might also not be as commonly thought of or as commonly known as some of the other wellness topics that we highlight. But what investigation means and what we try to encourage for this topic is for you as an individual to think of yourself as a research experiment, and you are the N of one. N means number. So anyone that knows research at all, N of one means you are your own research experiment. So we really try to highlight and to have people think of their own strengths and to highlight kind of what people's vision is for their own specific life and to really focus on what matters to them. And when you think of yourself as an experiment, you come up with a hypothesis, you find results and conclusions. It can lead to a meaningful life and improve your well-being. So moving on to N for nutrition, this is definitely a hot topic in our program, as you can imagine. Nutrition is actually, we dedicate 2 sessions to this topic. We invite nutritionists to join us. We even have a cooking class. This is a really interactive, hot topic that we talk a lot about. We can boil it down to the quote on this slide. We also love quotes in our program, by the way, but eat food, not too much, mostly plants. That's about as basic as you can get, but there's a lot more to it, which again, we really devote the 2 weeks in talking about this. But this simple boiled down quote is what we really focus on. And we also highlight the healthy eating plate from Harvard Medical School that you see on the left-hand side of the screen, which is the newest, latest and greatest kind of general measurements of what we should have on our plate. We like to say, eat the rainbow in paving. We have a lot of kind of paving quotes that we've adapted over the last 5 years. But this topic, as you can imagine, comes with a lot of questions, and it's fun to incorporate guests, nutritionists, and experts in this hot topic. So G is for goal setting, which we have a session on, but we also really try to focus on encouraging participants to set SMART goals. SMART goals, for anyone who may not know, is a specific way to set a goal that makes you more likely to achieve your goal. S stands for specific, M for measurable, A for attainable, R for relevant, and T for timely or time-bound. So after each topic session, we kind of focus on setting a goal, whether or not participants share with the group or maybe share with an accountability buddy. We try to focus and have people realize that being accountable when you set goals makes you achieve your goal in a much more meaningful way, in a much better way when you have somebody that you share your goal with, whether you write it down, you verbally share, you connect with others and share goals. It's very impactful. And people do love this part of the program. So S is for stress resiliency. So highlighting each of these topics in a very brief slide. We could really dive into this topic a lot more than this, but we like to think of our program as giving tools for the toolbox to people to help manage stress, which understandably comes with a cancer diagnosis. We as humans have so many tools in our toolbox that we can reach into and grab if we know about them. So we really focus on delivering and educating any and every resiliency tool that we can to our participants. We invite yoga instructors to join us for this topic, and also this topic, T for timeouts. We have invited yoga instructors and people to come to do a mindfulness exercise or meditation. Timeouts is maybe a less known topic as well. It certainly can have a negative connotation when dealing with children who might be in a timeout, but this is a positive timeout. So this is a timeout where we remind people how important it is to take breaks in the day. So whether or not you're home, you need to take breaks in the day, or if you're at work, or if you're caring for children, whatever you're doing, frequent breaks throughout the day make a huge difference in what you can do and how you feel. So an example of a timeout might be calling a friend to connect, or maybe taking a 10-minute walk, or listening to your favorite song. So this session highlights all the examples of timeouts and why it's so important to our day-to-day life. So E is for energy, and we love this spoon theory that was kind of recently brought to the program by one of our social workers who who helps lead the program. And I know I learned this through the program as well. So when we think of our energy, if we can imagine a jar full of spoons, and this diagram kind of shows the spoons in the little mason jar there. So we can imagine every spoon as an amount of energy. And we start our day with a jar full of spoons. We hopefully wake up with some energy. And everything we do from the moment we wake up takes an amount of spoons. So for example, you might, when you get dressed and get up and moving, that's 1 spoon. Another spoon might be when you do an activity or maybe make a meal. The point of this is we only have so many spoons. We only have so much energy in our day or in our jar. So we need to be mindful of our spoons and recognize when we're getting low on spoons and when we might need to wash our spoons. And washing the spoons is kind of the metaphor of what we need to do for our body. We need to sleep. We need to be easy and give ourselves grace, be easy on ourselves, and accept support from loved ones. So this is a nice way to think of energy and how to conserve it throughout the day. Especially we know our patients who go through treatment for their cancer, their energy is significantly impacted sometimes, and we really want to help with that. So we focus a whole session on talking about energy and ways to boost our battery and focus on ways to try to avoid things that drain our battery or our jar of spoons. So we have a topic of purpose that we highlight, and this topic I find can be very challenging and hard to talk about. It can be an emotional thing to think about, and oftentimes it's something I think that many people, including myself, we don't think about on a regular basis. So having a session devoted to this topic of purpose is really meaningful, and this topic is important to consider and talk about with others. So I always enjoy this topic very much. And sleep, as you can imagine, we have a lot to say about sleep. We've invited some experts from Mass General who are sleep experts who come to share their expertise with cognitive behavioral therapy. We share all kinds of sleep tips in this session. And as you can imagine, we understand and recognize that our patients do experience sleep disturbance to a significant degree for various reasons. And we want to try to help people improve their sleep habits and focus on this topic. And we're getting near the end here of our topics, but the S is for social connection. And I love this picture. This is, I think, the original PAVING group. And Dr. Commander can correct me if I'm wrong, but it seems to be. And we like to focus on how important it is to have a variety of social people in your life, whether it's your family, your friends, your neighbors, your colleagues, your paving pals, whoever it is. We really want to stress the importance of how keeping social connection in your life makes such a difference in your health and your wellness. So this is a fun topic that we always end with. And it's a way to kind of connect and celebrate our program and end with this fun topic. So that is the completion of our program, and the steps here. We also, as part of our paving wheel, encourage our participants to think about all of these topics in their own specific life, and to use the paving wheel that's, I think, on the next slide. Thank you, Dr. Commander, to plot your wellness for yourself on this wheel. So this is something we love to encourage people to do at the beginning of the program, and to save that copy and look at it again at the end of the program, and to see if there's been physical kind of actual growth on the chart. It's nice to see and really exciting to see the growth that people do have in this course by looking at it on this wheel. So, and I will turn it back over to Dr. Commander, but I've been so lucky to be part of this community over the last 5 years with Dr. Commander and our leadership team, and I learned so much each and every course, and we've built such a strong community, which you'll hear about next from our amazing participants. Thank you.
Thank you so much, Elizabeth. So just highlighting as we conclude these slides, the wonderful community that is formed from this program, which you'll hear from Judy and Liz better than me, but these are just a few fun pictures. We do host a 5K each year to fundraise for this program so we can make it free for all participants to join. And again, we're doing this series so we can bring this education to patients with all types of cancer diagnoses, not just breast cancer. But I just wanted to highlight how wonderful it is, this community that we formed, and we'd love to see this form for all individuals. And on that note, I just have to share this slide because I'm so proud of our incredible team. You will see all of these individuals over the course of the year in this series that we're launching. We've all taken some of our favorite topics, as Elizabeth just outlined. We've divided them up, and we will be doing webinars on each of the topics so you can learn from all of us. In fact, putting in a plug, October 8th, Sylvia Perry and Lauren Winters will be talking about exercise. Their webinar is entitled Exercise as Medicine, Why Physical Activity Matters for Cancer Survivors. So mark your calendar for October 8th, but we have a flyer that shows the dates for the entire series. And so just highlighting, this is really a wonderful multidisciplinary team. I'm going to read everyone's name: Dr. Stephanie Eisenstadt, Isabel Pupawis, Carol Sullivan, Dana Haggett, Sylvia Perry, Kirsten Anderson, Caroline Coyle, Lauren Winters, and of course, Elizabeth Abraham. And there's me. So anyway, we're so excited to tell you more about our series, but I'm going to stop sharing so we can actually learn from PAVING participants and actually see what they have to say about the benefits of this program. So hello. So on that note, we do have some questions we are going to pose to our wonderful guests, Judy and Liz, but we do welcome those of you who are watching this webinar to feel free to put comments in the chat or questions, because certainly Elizabeth and I can ask so many questions, but we'd love to hear what you are interested in. So just to kick us off, I hope it's okay, Judy, if I ask you the first question. Sure. By the way, Judy and Liz will tell you why they're wearing what they're wearing too in the course of this discussion. But Judy, as you look back at when you first joined the PAVING program, and I know this is hard, but can you pick one of the most impactful changes that you made as a result of the program, whether it was in your mindset, your sense of community? Pick one thing and reflect on it for us.
Thanks. And when I join these type of sessions, I feel like I always get emotional because, having get a diagnosis of breast cancer or any type of cancer is very scary. And, but for me, having gone through that, 4 years since I participated in the PAVING program, and a little over 4 years that I got diagnosed with breast cancer. But having gone through the PAVING program has given me such a positive outlet to give back. And, listening to, Dr. Commander and, as well as Dr. Elizabeth Abraham, talk about the program, every single thing that they talk about, the attitude, the goals is so important. And I think that the one thing, or probably the sense of community for me is, I had many conversations after, like, I don't think that Dr. Commander and Dr. and Fritz, and I apologize if her name, but realize the community that they created by having this PAVING program, and the text messages, the Facebook group post, the events that they have, being able to be with people who have experienced, and every journey is different. I realized with people with breast cancer, what I went through was very different than somebody else, but there were so many common threads that we could relate to, and that social connection was so important for me.
Love that, Judy. Thank you for sharing. And you've been so integral for helping us develop such a supportive community. So thank you. I'm curious, Liz, if you want to reflect on this, can you think of one impactful change you made as a result of the program?
Oh, wow. Well, I think for me, there's a lot of things I want to touch on that Judy mentioned, but I think for me, it was also, cancer can bring a lot of confusion. And so I think this program for me helped me get some clarity, and also clarity and permission that you don't have to take on everything all at once. So the structure of the program and the paving wheel kind of gave me an opportunity to take stock. You shouldn't need a cancer diagnosis to take stock, but sometimes you do need a jolt. And for me, it did give me an opportunity to take stock, and using the structure of the wheel, and I love a good framework, it really helped me to create some measurable goals around certain areas where maybe I was out of balance and didn't quite realize it, or it took kind of this program to maybe put it down on paper, literally. And I really did. I still use the paving wheel today. I've even used it in my workplace with people who don't have cancer, because I just think it's really pragmatic. And I think it can also help you like you're feeling like you're making some incremental changes, and you don't have to take it all at once, because it is very confusing. And I think for me, it gave me more clarity to focus on some areas that I could work on in a tangible way.
Thank you so much for that answer. So great.
I love that. I love hearing from you always, Liz and Judy. Thank you for being here. I always learn from you. I always learn from everybody in this program, whether you're teaching or a participant. I think I'll go to the next question. We'll go back to Judy maybe. So many survivors describe a teachable moment after diagnosis and treatment. What surprised you about the process of participating, and how have you been able to transform these moments into lasting habits?
Great question. I mean, I think, similar to when when Liz was talking about, each of the different pillars, and likewise, trying to reflect on being more of an advocate for myself. And I think trying to kind of keep everything in balance, like trying to take every single, every single kind of circle, and how to apply that to my life, and keeping things in balance, but making changes, like making sure that I'm holding myself accountable with some of these goals of what things that I want to do, whether it's work, personal health, whatever those goals might be. And there's so many things. I mean, I feel like there's so many things within the paving program. Having that accountability, partner was so important. And it's not just even in health, but in life. And whatever that, I started thinking of my different things of what my goals might be for whatever, a week or month or a year, and how to get to those goals. And, whether it's having, helping somebody to be accountable with me, making some changes in my, nutrition, how to, having the balance of variety of exercise and doing those. I think those are the teachable moments, is reflecting on myself, on how to be a better person, and reflecting on why was, I given this diagnosis of breast cancer. I truly believe that is to be an advocate for breast cancer, and making, others aware that you can thrive and survive with breast cancer. And I don't want to say be enjoyable about that, because it's I don't want to sound, not real about that, but how to help others. I've had so many people reach out to me who said, can I talk to you? And, being able to, share that's, I feel like the paving has kind of taught me.
I love that. Thank you, Judy. And I also need to highlight, in case anyone hasn't noticed, that both Judy and Liz are wearing our paving swag that we love. And I wish I had something of mine on, but we have a water bottle, a t-shirt, and a sweatshirt, which just, again, highlights the community and the team building that we have for one another, and just a fun part of the program. So Liz, I think I'll ask you a similar question. What was how did paving help you develop these lasting habits, and what maybe surprised you about this process?
Well, I also, I really love sort of all the marketing around the packaging, in a way, the marketing of the paving program, not because it's, you know, some really nice swag, but also because it really makes sense. And
Mhm.
the paving pathways, that concept of the path, that it isn't a straight line. It's not, you know, paved with asphalt. You know, a path by its nature is meandering, and the program talks about potholes along the way, and you know, roadblocks and things that might kind of take you away from where you thought you were headed. And I think this program gives you permission that that's all okay, that that's
Mhm.
all part of the journey. And so for me, the kind of teachable moment was, you know, wanting to change everything so quickly and all at once. And oh my gosh, how can I make sure this doesn't happen again? And what can I do to improve my survivorship? And you start to realize that there are a lot of many facets, many of which are out of your control. But I think getting the tools to and accountability through paving each week to kind of dive into some of the different aspects that you can tackle was really helpful for me. And for me in particular, although I work in the kind of wellness field, I probably was less versed in some of the nutritional aspects. So for me, I really dove into some of the learnings from nutrition and making some incremental changes in what we served, you know, what we prepared at our house, how I looked at labels. I just became a bit more knowledgeable, and that wasn't a really good thing for me to take away. And then, you know, sharing that with others when, you know, when I'm out with friends, and kind of like almost in a way, like Judy said, like helping others kind of learn from this program, even if they're not a cancer patient.
Thank you.
Thank you, Liz. And I think that really highlights another benefit of this program, sort of what you just said, this ripple effect, like for folks who participate in the program and who are benefiting from all this knowledge and making all these changes. You know, they'll tell their friends about it. They'll tell their family members about it. We've heard so many stories about everyone's having meatless Monday now, you know, stuff like that. So it's really wonderful to kind of hear those examples from you and Judy. So thank you. Judy, I'm going to pose the next question to you. So I know many who are watching this webinar are maybe learning about lifestyle medicine for the first time, and
Mhm.
pillars which we outlined. Again, I'm going to review them: physical activity and nutrition and stress management and social connection and sleep and avoiding risky substances. And I know it's hard, but I want you to pick one pillar of lifestyle medicine that you may be focused on as a result of the paving program, and share some specific changes that you've made that maybe you continue to follow, even though you're a little far out from the paving program now.
No, sure. And it is very hard to pick one, because I think every single, you know, pillar has a benefit in having that balance. But I think probably, since having been diagnosed with breast cancer, one of the things I would highlight for myself is the physical activity. And, you know, prior to being diagnosed with breast cancer, I was a runner, not as avid as, or as, like Dr. Commander, but, a runner. And having been diagnosed with breast cancer, for myself, I felt like I took some time off, and I, mentally struggled with, having a little bit of some, changes with some of the results of going through radiation and some of the, surgeries that I had. And for me, you know, I now, I continue to kind of focus on physical activity and what I can do, and having those goals for myself, and, making those changes myself to live a healthier lifestyle. I think that was, again, probably one of the things that continuing to be like, even though I had breast cancer, I can continue to thrive.
Thank you for sharing that. And I will agree, in the program, by the way, we don't expect people to be marathon high rocks or whatever, but we like to meet each person where they are. And we recognize some people really haven't embraced physical activity, and it's a work in progress. And we try to start, giving recommendations for how to incorporate this into one's lifestyle. Because again, this is part of ASCO recommendations. And so Liz, I'd love to hear your thoughts. If you want to pick a lifestyle medicine pillar that made an impact on you, that you really learned about in the program and you've made some changes in.
Sure. Well, I would say I kind of almost have two. It's hard to pick, but my first one that came to mind was the social connection. I am a pretty extroverted person, but as what I found was, as coming out of the pandemic and raising a family and running a business, that I really was lacking in the social connection for myself with friends, and sort of not making that self-care time to connect with people. And so I have definitely made more of a conscious effort to say yes to, the get together for a walk, for the coffees, but even just, I'm now in a virtual book club with friends from college, making time to connect with people via text. And it doesn't have to be a daunting thing. And I don't know why, life had got that way, but I felt like, wow, the paving program really did show the power of how you can get so much joy, empathy, but also gratitude when you're connecting with one another in person, in a meaningful way. So that was really helpful for me. And then I will say the paving program, the resources of Mass General, the experts that you brought in was also for me really powerful, because then I connected with nutrition. I connected with, a specialist from the Mind Body Institute, so I do feel like you kind of opened the lens and the aperture of some of the resources that are available to all of us that I didn't really know about.
That's a great answer. Thank you for sharing. Yes, social connection, so important. Love that you're prioritizing that as we do in the program. And then highlighting how you learned about so many of the great resources at the Mass General Cancer Center. We're so fortunate to have so many wonderful programs and experts that we can refer patients to. And actually, Elizabeth, you are like the queen of this. I'd love for you to share a little bit examples of how you have incorporated some of these wonderful colleagues into the paving program to, for example, music therapy. So I'm going to let you take it away.
Oh, sure. I'm glad you brought this up, because I think I agree with you all that this part of the program, kind of incorporating guest speakers who are experts on different topics, highlights the fact that we are a multidisciplinary group that are running the program, but then to bring in the real experts on each topic is even more fun. So other examples are different integrative therapies, such as acupuncture. So we had invited a acupuncture therapist who works at the hospital, who I've known for many years, to come and speak to us about the benefits and how it works. And that corresponded kind of with our energy topic. So we talked about how that can help combat fatigue as an example of many of the benefits of acupuncture. Other guests we've had are people for different physical activity experts, so trainers. So we've had trainers join us, we've had bar teachers join us, we've had yoga instructors join us. For that hits a variety of topics, but we've done movement together on the screen during our sessions, which kind of might sound embarrassing to some, but it's kind of also fun. And if you're embarrassed, you just put yourself off a video and you do your movement on your own. So we're a very dynamic, interactive group that loves to include the experts. Music therapists have joined, like Dr. Commander mentioned. People have come to sing to us, to play music with us, and talked about the benefits of music therapy, which is something that here at the main campus, where I am today, we have so much opportunity for all of these extra integrative therapies to be part of our patients' experience here at the hospital. So it's been fun to kind of tap into everybody and invite people to our program. And I love to include all the people that I know throughout my years of working here to kind of be part of the program and spread the word. So it's been a lot of fun. Thank you for bringing that up. And I think, on the topic of community support being such a big part of the program, and social connections kind of being the ending of our 12-week course with the paving program, I'd love to hear a little bit about, Judy and Liz, what the impact of our community support on helping your goals has been with the program. What has been most impactful? Judy, I'll start with you.
Okay, great. So as far as the impact, I would say probably one of the biggest impacts for me going through the paving program is been able to give back to this program with the community. And with that, when Dr. Commander mentioned about the 5K, the year that it was 2022, when after I'd gone through the paving program and the group that I was in, we actually loved meeting together virtually. And we actually still continued to meet on I'm trying to remember at the very beginning if we were meeting a bi-weekly time as well, or as weekly. I can't remember the details, 3 or 4 years ago. But at the time when Dr. Commander talked about the 5K, we were kind of still a little bit in the height of COVID as far as get socialization and kind of meeting people. But we wanted to do something as a group to meet people. We had felt like we were such good friends, but we had never met in person. So we were talking about doing it at a park or anywhere. And I'd opened up my home and I said, why don't we meet at my house? We'll have a place to go to the bathroom, which is important. And, we'll do a potluck. And that first year, 2022, I think we had probably, we had some friends and families and caregivers and us that first year. And we were very fortunate, we had MGH, Dr. Commander and others, staff, join the walk. And I think that first year we had 35 people attend. And since that has grown, I think this past year, 2025, I don't know, somewhere between 60 or 80 people, it's a range, but, showed up for the walk. And, that to me, in meeting my goals as far as being able to have a sense of community and, I can't tell you, like to the people on the phone, what the paving program has been able to give this sense of belonging to this, and to be able to give back to something that really helped me through such a difficult time.
I just have to
Thank
say,
you, Judy.
her 5K event, so fun. Thank you.
Yeah.
Liz, we'd love to hear your answer too.
Yeah, sure. So definitely from the community standpoint, I mean, I have definitely learned to say yes to lots of things. I've gone twice to the 5K. I'm wearing the t-shirt from Judy's event. I've gone to some of the other programs that Mass General has run down at the Hat Shell. I've hosted a retreat 3 years in a row at Artemis Yoga. But I would say, all of those kind of structured events. In addition, there's been a cohort of us from my paving group that would get together for lunch, maybe kind of once a quarter, if you will. And, I do know that I've been able to reach out to people with things here or there. I meet a couple ladies at the YMCA in Newton as well. So I do think just you sort of feel like you have a team, a team of people. Like I know, like if I have a question, I could reach out to Judy for something. You just have a new way to connect with people because you've had this shared experience. And I think it's, we've each had our own 12-week program or, cohort, but then there is that common bond with the other cohorts when you get together at some of these community events. So I think that's a real special part of the program too, that I didn't expect, but that I've really been enjoying the past couple of years.
Yeah, no, I just want to echo as well. I think, or validate what Liz is saying. It's like you kind of, when people talk about people who have breast cancer as, your fellow sisters, it is so true. Whether, I have a pink bracelet that I wear and I'll be even out in wherever. And it's like, you just feel that bond. And even more so, people have gone through the paving program, people have shown up to the walk, or, I've been able to attend Liz's yoga retreat, and many of the other, paving, we've done walks, we've done, 5Ks. You just feel this sense of immediate connection with somebody, like it's somebody you've known your whole entire life. And that social connection, I don't think you realize what you created, but it has been so beneficial I think for so many people.
Love that. Thank you both for sharing. And yes, also I have to say, Liz, thank you. Your yoga retreat is always amazing. We're so great.
Thanks.
Great highlight. I think just what you're both saying, I want to say, we have had some pilots now of doing paving Jill Burke and Dana Cameron, colleagues of ours who work with patients with multiple myeloma, have been developing a group for patients with multiple myeloma. And it's been same kind of thing. If we had them on this Zoom, they'd say the same thing. And maybe we will for a future one, just sharing how wonderful it has been to be part of a community of people who get it, who truly understand what it's like to live with a diagnosis of breast cancer or multiple myeloma. And hopefully in the future, we'll be able to offer this for individuals with all types of cancer. And that's why we're doing this series, to really bring this education to light for everyone. Just highlighting at ASCO in June 2025, a really important study called the Challenge Study was reported, which showed the immense benefits of physical activity and lifestyle education for individuals with high-risk colon cancer. So the tools we're sharing are relevant certainly to breast cancer. I'm a breast oncologist, so that's how I got started doing this. Elizabeth has also worked so closely with patients with breast cancer over the years, but we really want to provide this series to educate all patients. And so we're just so grateful to hear from all of you. I just want to share one comment that's in the chat, and then Elizabeth will go with our next question. But I love that one of our Paving graduates, who I know is watching right now, actually, she was part of the originals. So thank you for being here. The originals was that first Paving group, but she did comment that the Paving group really helped her face the fear of having a cancer diagnosis. She states that it gave me a vocabulary to speak out loud what I was thinking about as I faced a diagnosis of cancer and how to move through life and address that fear. And that's just so powerful and beautiful. So thank you for sharing that in the chat. And there's a lot of wonderful comments there that I think are amazing. I'd love to share them all. But I really just am so grateful for everyone who's joined today. So Elizabeth, I'm going to turn it over to you to pose the next question.
Thank you so much. I know it's hard to believe we're at the top of the hour here. I just want to share one other comment that just as we're getting these comments, I just feel so grateful again for being part of this community. But I think I'll share one more if that's okay. And this is from somebody who have participated in the program previously. And she says she felt like she was in trouble, quote, in trouble when she first got diagnosed. And then after Paving, it felt like she was, quote, in charge of her life and wellness as best as anyone in capitals can be. The evidence-based information was key, and I'm so glad you highlighted that, because everything we talk about is evidence-based, and the why, but hearing from other survivors and thrivers is the how. So I just had to share that one among many other great comments that are coming through. So yes, so our last and final question, Judy, if you could reflect just overall, simply what comes to mind, what is the greatest gift that the Paving program has given you?
I mean, you've heard all the other, amazing things, but the greatest gift about the Paving program is, when you talked about the Paving program, you talk about bringing in the experts and bringing in all these different resources. And I want people to understand on the call as well, is that it also gave us the voice to interact with others. And as we're talking about nutrition, we all of the people in our squares, talked about that, and perhaps talked about some of the struggles with maybe nutrition or whatever the topic was. The Paving did such a great job of weaving the experts with the, the participants. And that, I think, the greatest gift for the Paving program is having that balance and the resources, to knowing that all of these amazing resources are available for me. And I've since, it's been 4 years, but I've been able to still, if I needed to, see a nutritionist, and, having to see a physical therapist, knowing the resources are available to me has been such a gift. And I mean, I don't want to keep on saying probably the greatest gift is the community, because I feel like it's been overused for myself, but that truly was the biggest overall, is the community.
Liz, we'd love to hear from you too.
Yeah, I'll be brief. I mean, I think just what I'm taking away from this and what I wrote down in terms of thinking about what the greatest gift was for me, it was that sense of clarity and empowerment, that sense of, like somebody mentioned in the comment, that you can be in charge, that you do have the tools to take on this journey, and you have the community to help support you along the way. But I think that the program really gave me a sense of empowerment with the resources provided, with the structure the program has. So it wasn't so daunting to take stock of this diagnosis. So for me, it provided a lot of clarity, empowerment, and in a way, maybe just sort of that supportive community to get it to feel that you could be in charge.
Wow, thank you both for your sharing such beautiful comments and insights, which are so impactful, I'm sure, for everyone who's here today. You're amazing. Elizabeth, thanks to you too. And I also have to thank the MGH Blum Center for helping us put on this series. Amy, who is the coordinator, has done such an amazing job. And again, we have an entire schedule for the whole year, so you can check the MGH Blum Center website for information and how you can join the next events. And in fact, again, putting in a plug for October 8th, when we'll focus on exercise as medicine and why physical activity is important for cancer survivors. And this will be led by Sylvia Perry and Lauren Winters, and it'll be amazing. So, but this has really been so wonderful. I'm so grateful for everyone's participation. And I will say, Judy and Liz and all paving participants, you are our greatest gift. And this is exactly why we've been offering this program now for over 5 years, and we want to continue to grow. So we just want to thank you as well.
No,
Thank you so much.
Yeah, thanks.
Thank you.
Thanks, everybody.